Angioplasty post-procedure precautions ensure you safe and peaceful life. Number 1. Take all the prescribed medications. Any discomfort, consult your cardiologist. Number 2. Ensure that you are on all essential drugs after angioplasty: statins, antiplatelets, hypertensive, diabetic drugs. If necessary, vitamins, and others. Number 3. First 1, 6th, and 12 months periods are important after angioplasty. Kidney function, liver function, any suspected infection and cardiac function are monitored. Number 4, no strenuous physical activity is allowed after angioplasty. Simple walking after 1 week and followed by mild to moderate like cycling, swimming, no professional sports activity. Number 5. Diabetes, hypertension, and lipid levels should be under control. Fasting and postprandial should be below 100 mg and 200 mg/day. Blood pressure below 130/90 mmHg is desirable. LDL 70 mg, TG 150 mg, TC 150 mg. Number 6. Normal sexual activity can be continued after 4 weeks. Largely acute stent closure or thrombosis would happen in first 4 weeks. Number 7. Foods and social habits are determining your life after angioplasty. Light meat, fish, whole grains, sweetless fruits, all kind of vegetables except root, walking, yoga, positive thinking, no or mild alcohol, and adequate water might improve quality of life. Number 8. Some life-saving medicines should be continued lifelong: statins, low dose of aspirin, anticoagulants, diabetic and hypertensive drugs. Number 9. Side effects of medications after angioplasty very unlikely, but some infections can lower platelets, and increases bleeding tendency. Example, dengue, COVID-19, and liver diseases. Proper assessment and restart would protect the patients. Number 10. Chest pain after angioplasty is a major concern. Microvascular angina, side branch occlusion, stunned myocardium, uncontrolled lipids, diabetes, and hypertension are the reasons. Even failed angioplasty also can cause severe pain. It needs proper evaluation. Number 11. Drugs abuse, smoking and alcohol should be stopped after angioplasty. Drugs abuse and smoking could cause stent failure and block other vessels also. Mild alcohol 30 to 60 milliliters twice or thrice in a week wouldn't harm. Number 12. Naturally some patients may develop block again in the stent. Non-modifiable risk factors are reason for restenosis of stents. They may need aggressive medications which include more anti-anginal, anticoagulants and antiplatelets. Number 13. How long the stent will last? It's a common question. Frankly, no one can predict the stent patency and durability. If everything goes well, the stent might be normal even after 20 years. Number 14. Is it possible to do angioplasty again with failed one? Yes, we will again open the failed stents with cutting-edge technology like rotablator, cutting balloons, intravascular lithotripsy, intravascular radiation and etc. Final option is bypass surgery. Number 15. Why in some cases angioplasty or bypass surgery cannot be performed? It is difficult to do any procedure in diffusely diseased coronary arteries with the involvement of entire segments and with the size of less than 2 mm. If that is the case, advanced medical care would relieve the symptoms. Number 16. Which is the best treatment? Angioplasty or coronary artery bypass surgery? Both are equally valuable and effective. But in some selected cases angioplasty is more better than bypass surgery. In some cases bypass surgery is superior than angioplasty. Number 17. Is it possible for second-time bypass surgery? Yes, patient can undergo redo bypass surgery after thorough evaluation and risk assessment. There will be mild expected complications, but it can be safely performed with anticipation of risks and complications. Number 18, can a heart failure patient undergo angioplasty?